Hi, I'm Dr. Roadhouse, and I want to introduce you to our patient, Jean Jacobson. Jean came in for our fibro program because when you came in, you were hurting all over, and we had you rated on a scale of 1 to 10, and you were a 10, right?
Yeah.
Okay, all right. And you had all the standard fibromyalgia symptoms, but you also had already been previously diagnosed with autoimmune with the psoriatic arthritis, and we've been having some issues with that. But still early in the program. Um, we did the labs, and I know you've been to a lot of different doctors with dealing with this. And had you ever, any other doctor ever even talked to you about those labs or run those labs or anything like that?
Well, they ran the ones that they usually run,
Right. Right.
but they didn't run any labs like you did.
Yeah.
And theirs came out negative, and some of yours came out positive.
Right. We use the Cyrex testing, so we found out, we got lots of good information from the labs. We also, when we did the lab work, we found out that your thyroid wasn't working right. And a lot of patients that have fibromyalgia, if they have it long enough, they're going to have some crossover symptoms, and they eventually, can't. Well, they possibly could get a thyroid problem, and that's why we tested you for that, because a lot of the symptoms, yes, you had all the fibro symptoms, but you also had the thyroid. You had irritable bowel, and how's that doing?
Yeah, it's right now it's a little bit better.
Okay.
It was my bowels were pretty explosive, but they are better.
Okay.
They're not great, but they're not. They're better.
Well, it's better than being explosive, right?
Yeah, really.
So that's a good improvement, and it's still early yet. And when we got the labs back, and then we found you had quite a few things, so we had to put you on a very specific diet based on your lab test. And we found a lot of things, and so it took you a while to kind of wrap your head around the diet stuff. And I said everyone's different. Some people can do it right away. Some people have to go in gradually and stuff like that. But you've finally done that, and since you've been doing that, you're feeling better, and you've lost.
I've lost about 18 pounds, and I'm still. I mean, being on a gluten-free diet with my specific issues, it's hard for me still, but I'm still learning even. So it's been useful, very useful.
Well, and the other thing is, remember I told you, I go, it's not going to be easy, but it's going to be worth it. Excuse me. And you are starting to see some improvement. It's early on. And is there anything else that you've noticed that's gotten better since then? You had so many symptoms. I wouldn't expect a whole lot to be better.
I have been. Sometimes I have bad days, with the psoriatic arthritis, but it's been more good days than bad days in terms of being able to move a little better, being like when I get up in the morning, not being, the pain hasn't been as severe.
Right, because I remember that was part of your problem in the beginning of the treatment, is you just were hurting and feeling so bad that you couldn't get in for your treatments. And so finally, when you did come in, you started getting improvement. That's right, I forgot about that. Yeah, so you are doing better that way too, which is huge, because you're able to feel good enough where you can come in for your appointments, because before that you were pretty much housebound, weren't you?
Yeah, and I still don't go out a lot, but that's mostly because of I get home health every day for my wound. I have a very large.
Yeah, she has a wound there, and it's systemic, and so they're dealing with that, and we're doing our part, and hopefully the two working together, we're gonna see lots more improvement. Okay, do you still have the brain fog?
Sometimes I do.
Well, before you came in, how was it then? I mean, was it there most of the time, and now you have times where, Because, just in the beginning stage of this, you're still going to have a lot of these symptoms because you haven't had a lot of treatment.
Yeah.
But I'm just trying to compare, like the brain fog that you had before you came in and where it is now. What kind of improvement have you seen in that?
It's better. Like when I came in, I would have rated it at about a 7, and now it's more around a 5.
Okay.
It's better.
Yeah. Well, when you have as many symptoms as you had, any little bit of improvement, because you've had all these symptoms for a long time. You've been to other doctors, and no one's been able to help you. No one's been able to help you with the bowel stuff.
Right.
And then you've tried different diets, and and now we got you on a diet based on your labs, and the ultimate goal is to get you better. But if you lose weight in the process, that's a bonus, and you've had an 18-pound bonus, so that's pretty good.
That's great.
All right, what about the neuropathy?
Oh, the neuropathy is good.
Okay.
I don't feel any neuropathy at all right now.
Okay, so we've done good there.
Yeah.
And what else you're pointing up here?
And I was going to say, I had in the past, oh, I don't know, past 10 years, I've had about 13 surgeries. So when you have that many surgeries, plus all this, it takes a long time for the body to recover.
Yeah.
So
we have to be realistic about, you're not going to be better in 2 weeks
Yeah.
or anything like that. Okay. What about your anxiety? Is that any better?
Anxiety, I don't know, it seems about maybe a little bit better. It's taken a while.
Okay.
And depression has also taken a while. I think that's because, when you go to see so many doctors, like I have doctor appointments every day, you're waiting and waiting and waiting for results or whatever, and it's a life of anxiety, really. You're just waiting.
Yeah.
So.
And then if you don't get good news, then you have depression with it, but it's maybe not so much clinical depression. You're just depressed about your health state. Okay. Now, what about the pain that you had? You had pain all over your back, and it was worse in the morning, and it was all over right there. How's that doing?
That's, for the most part, a little better.
Okay.
Yeah.
That's good.
Yesterday, I actually went for a walk.
When was the last time you did that?
It's at least 6 months ago.
Yeah, okay.
Yeah.
All right, and let's see. What about the leg weakness?
That is still, we're working, I went for the walk, so I think it was a little better, but I could feel it this morning that I went for the walk.
All right.
So.
And we just started working on the memory, with the auditory stem. And then what about, remember when we did your exam, your balance was really bad too?
Yes.
Has that improved anything yet, either one of those two?
Balance, I think is, I'm not sure. I don't think it's improved.
If it's not for sure, don't say it, And then memory, we haven't been doing that long enough, so I doubt that's been improved that much. But you did say, trouble losing weight, yes, and, so that we're starting to do. Okay, so I think that's pretty much it. It's not a whole lot, but, for as many symptoms as you had and all the different doctors that no one's been able to help you, your color looks better. I'm sure people have told you that. And you smile where you were not smiling at all, when you first came in your first month or so of treatment stuff. So I think what we'll do is let's just go with this right now.
Okay.
And then we'll check in with you in a couple more months, and we'll keep this list here, and then we'll go over it and we'll see how you do. But so far, at least we're getting results, right? And that's a good start.
Yeah.
Okay, well, check in with us a little while. We'll follow Jean's progress, and you can watch her video and see how she's improved.